When it comes to a cosmetic surgery procedure, plastic surgery patients universally have two questions. What should I expect from the effects of anesthesia in plastic surgery? And do I need to worry about feeling pain or waking up during surgery? These are perfectly reasonable, valid questions. Patients who don't flinch at the idea of going under the knife get understandably nervous when they're about to undergo general anesthesia, and they want to know as much as possible about what to expect from their cosmetic surgeon and care team. Welcome back to Limitless. It's been a while, but we're back. We want to thank you for watching and making it possible for us to keep doing what we do best. The Brazilian butt lift, or BBL, is one of the most popular procedures right now. The procedure allows women and men to remove stubborn fat from around their waist, sides, and lower back. The surgeon then inserts that same fat into the buttocks and hips to create an attractive hourglass shape. If you've been considering this procedure for a while and have finally booked it, congratulations! You're one step closer to achieving the body of your dreams. Before going through any plastic surgery, you should make sure to do your research. Preparing yourself and knowing what to expect will make you feel calmer going into surgery. Additionally, it will ensure that you have anything and everything you need to aid in a successful procedure and a speedy complication-free recovery. It's not unusual for patients to wake up from anesthesia after undergoing a surgical procedure. This is particularly true for patients who receive general anesthesia, which means they are completely unconscious and unaware of their surroundings. If you wake up during a BBL surgery, the surgeon will usually ask whether you are okay, and if so, they will continue with the procedure. If you cannot communicate verbally, there are other ways to communicate with them. A nurse or doctor can give you medicine through an IV line that will make you more comfortable while they continue their work. In some cases, they may be able to remove some of the anesthesia so that they can speak with you directly. Some people have reported being able to see out of their eyes, called ocular reflexes, while under general anesthesia. Others report feeling hot or cold when awake during surgery because of the location of their incisions or other reasons. Some surgeons allow patients to move around on their own once fully awake in order to check on them or treat any medical problems that may occur during recovery times. If you wake up in the middle of surgery, it's important to talk to the doctor or nurse immediately so that they can make sure everything is okay and that there are no complications with recovery or healing that need immediate attention. The most common reason for waking up during a breast augmentation procedure is because the patient suddenly feels pain in their chest or ribs. This is not normal and should be reported to an anesthesiologist immediately. If you wake up during your BBL surgery, it is important not to panic. You will need to follow the instructions of the medical staff as they will be trained to handle all emergencies quickly and efficiently. In most cases, patients are able to return home after just one night in the hospital. But if you are still having trouble breathing or feel dizzy, it may be time for you to get help from an advanced life support team at the hospital or get back into bed until they arrive. Make sure the doctor has closed your incision completely so no stitches show. This will give them time to clean up and readjust anything that may have changed after they closed your incision. You may also want to ask them about what happened while they were operating on your body, if anything went wrong, or any issues that may have arisen during surgery, such as pain or numbness. These issues could require additional treatment before proceeding with the rest of your procedure, which is why it's important for them to know about it now that they can take care of them as soon as possible before coming back into the operating room with you later on. You may need to stay in the hospital for a few more days after surgery, so your doctor will have time to address any issues that might have occurred during the procedure. You may also need additional care at home for a day or two after surgery. It is important that you hold still and not move around much during BBL surgery. If you move too much, it can cause damage to your implants or other tissues. If this occurs, your doctor will stop the procedure and let you rest until he can assess the situation and make another plan of action. A BBL surgery, or fat transfer, uses a patient unwanted fat from donor locations to improve the shape and appearance of their backside. It is a more natural way and popular method for butt augmentation. The ideal candidate for this cosmetic procedure should be healthy and have the necessary amount of fat in donor sites to adequately provide the right BBL results. Probably the most common question that patients ask is how they'll be able to sit after Brazilian butt lift surgery. You should avoid it. Temporarily, of course. Try not to sit directly on your butt for 2 to 6 weeks post-surgery. If you need to sit, then you will need a BBL pillow, which allows a small cushion to go under the lower thigh while taking the pressure off the buttocks. In case you don't have a BBL pillow, a towel can help. Another thing you can try is sitting backward on the chair. When in the bathroom, don't sit directly on the toilet. Instead, you should squat or hold on to rails. Again, avoid sitting for 2 to 6 weeks or any period of time advised by the surgeon is crucial. A healthy lifestyle is always important, but we often take it for granted. It's never too late to start making some wiser lifestyle choices, especially after the Brazilian butt lift procedure. If you have a habit of eating junk food, try to make a healthier switch and a well-balanced diet. After surgery, the body is getting used to the new changes in vitamins, minerals, enzymes, and other nutrients that are important for recovery. Try to add fruits, vegetables, lean protein, low-fat foods onto the menu. If you're a smoker, try not to smoke after the BBL procedure. Smoking can interfere with the healing process because it narrows down blood vessels and impairs blood flow. Additionally, you should stay hydrated throughout the day. Not all fat transferred into the butt will survive the plastic surgery long-term. The fat survival rate depends on a couple of factors, including the techniques used by the surgeon while removing fat and a patient's recovery progress. Generally speaking, the survival of fat is between 50% and 80%. The best way to ensure a high fat survival rate is to focus on the recovery. Follow the surgeon's recommendations and don't do anything that may impact the integrity of fat cells or compromise the affected area. If you're an active person who loves to work out, then you're probably anxious to start exercising again. While remaining active is not forbidden after BBL, you need to be wise. Patients must avoid all types of high-impact physical activity until a surgeon approves. Engaging in vigorous exercises can impair the healing process and compromise the transferred fat. In most cases, patients are allowed to take part in low-intensity physical activities within 2 to 3 weeks post-surgery. The low-intensity physical activities are those that don't put too much pressure on your body, especially the butt area. For example, you can start fast-paced walking then. Pending everything till 6 weeks is okay with a treated area. The surgeon may approve engaging in more vigorous activities such as cycling and running. This depends on whether the transferred fat cells are stable enough to withstand the pressure caused by strenuous activities. Recovery after Brazilian butt lift is demanding, especially if you woke up during it, but the final result is amazing. You need to be patient and do your best to stick to the recommendations provided by the plastic surgeon. Consult the healthcare professional for all concerns you may have during the recovery. Always keep in mind that the more you're proactive about the recovery, the better the results will be. Well, that's it from this video. What do you think about BBL surgery? Do you think you will tackle the challenge if you ever woke up during a BBL surgery? Share your thoughts by commenting below. If you enjoyed this video, hit like and share this video with your friends to help spread awareness. Also, considering subscribing to our channel for more interesting videos every week.